Welcome back to Ophthalmology for Undergraduates and Postgraduate Beginners. Today we are going to talk about examination of the anterior chamber. In the anterior chamber, we have to examine two things. One is the depth of anterior chamber. Next thing is the content of the anterior chamber. The content of the anterior chamber is aqueous humor. When we talk about the depth of the anterior chamber, we should know the boundaries of the anterior chamber. Anterior chamber is bounded by the cornea in front, iris behind, and in the pupillar area you have the lens. This is the anterior chamber. The depth of the anterior chamber in the center is 2.5 millimeters. Depth of the anterior chamber in the periphery is 1 millimeter. Now I am going to demonstrate how to test the depth of the anterior chamber. You have to take a torchlight like this and throw the torchlight from the temporal side into the patient's eyes. The examiner has to stand facing the patient's face and he has to observe at the eye where the light is thrown. When you observe at the eye, see here I have drawn an eyeball. I have drawn another picture of the iris. When the light is thrown from the temporal side, what will happen? The light will fall on the iris surface and the iris can be clearly seen. In the picture, you can see that the iris is having a small convexity outwards because of the convex nature of the lens behind it. There will be some kind of depth in the angle of the anterior chamber. This is the angle where the cornea meets the iris. There is a small depth there. When the light is thrown, this light will fall on the entire temporal iris. It will fall on the nasal iris also, except for this depth on the nasal side. So what will happen? You can see the iris clearly with its color and pattern on the temporal side and also on the nasal side, except for this depth portion which becomes dark. The light does not reach that depth on the opposite side, so that area alone becomes dark and it looks like a eclipse. This is called as a eclipse sign. When you see such a shadow, small shadow on the nasal side, then the depth of the anterior chamber is said to be normal. Already I have explained about the normal depth of the anterior chamber. Now let us see what is a shallow anterior chamber. When the iris is very close to the cornea, so the iris falls forwards due to some pathology. What happens is light shown from the temporal side will fall on the iris on the temporal side. Because the nasal side of the iris is somewhat directed away from the light, what will happen is more than 1/4 of the iris will have a shadow. Sometimes it can be up to half the diameter of the iris also. If there is such a shadow which is very big, unlike the normal iris shadow here I shown, then it is said to be a shallow anterior chamber. Now let us see what is a deep anterior chamber. When the iris falls backwards, this is classically seen in aphakia, absence of lens in the patellar fossa. So what will happen? The light, when it is shown from the temporal side, it will fall both on this temporal iris and as well as on the nasal iris. So there will not be any shadow at all. There is no small eclipse or bigger shadow. Nothing will be there. Entire iris will be clearly seen. Then it is said to be a deep anterior chamber. In case of iridocyclitis, which is there for a very long time, the depth of the anterior chamber can be of two types. One is a ring synechia. What do you mean by ring synechia? The pupillary border alone is attached to the lens anterior capsule. So you can see here in the first picture, the pupillary margin is attached to the anterior capsule of the lens. What will happen is, normally the aqueous humor which is present in the posterior chamber, that is behind the iris, gets accumulated there due to continuous secretion of aqueous humor from the ciliary body, and it will make the iris bulge forwards. Normally the aqueous humor will flow from the posterior chamber through the pupil into the anterior chamber. Because the pupillary margin is completely attached to the surface of the lens, the rest of the iris is ballooned outwards because of the excessive collection of aqueous humor behind the iris. This is called as iris bombae, and this is present in ring synechiae. When you see the depth of the anterior chamber here, the periphery of the anterior chamber will be shallow, the center will be deep. This is called as funnel-shaped anterior chamber. Next is total posterior synechiae. What is this total posterior synechiae? In the previous picture we told only the pupillary margin is attached to the anterior capsule. But here the entire iris itself is attached to the anterior capsule of the lens. So what will happen here? The periphery of the anterior chamber becomes much deeper compared to the center. It is due to the curvature of the lens. The lens is convex. So the periphery becomes deeper, in the center, because of the thickness of the lens, the depth will be normal. Normal content of the anterior chamber is the aqueous humor. But sometimes there may be abnormal contents in the anterior chamber. Aqueous humor is a ultrafiltrate of the blood. Actually, the milk of the humans is an ultrafiltrate of the blood, but aqueous humor is much more an ultrafiltrate of the blood, because the aqueous humor is very clear and transparent, because it is devoid of cells, it is devoid of proteins. Here you can have the following abnormalities in the aqueous humor. In case of iridocyclitis, inflammation of the uveal tissue, cells may accumulate in the aqueous humor. The cells can be counted with the help of the slit lamp and it can be graded. Flare, outpouring of proteins into the aqueous humor, making the aqueous humor turbid. The flare can also be graded using a slit lamp. Hyphema. Hyphema is nothing but collection of blood in the anterior chamber. They say that even one red blood cell in the aqueous humor is said to be a hyphema. You need not see blood in the anterior chamber. One RBC is enough to say it is hyphema. Hypopyon, presence of WBCs or pus cells in the anterior chamber. Already in cornea we have seen what is hypopyon. What are the types of hypopyon? Just see the previous video. Next, air can be present in the anterior chamber. Sometimes anterior chamber is formed with the air during cataract surgery for certain reasons. Some gas forming organisms can lead to collection of air in the anterior chamber. Next is worms. You can have parasites in the anterior chamber aqueous humor. Foreign bodies can be located in the aqueous humor, either floating or it may be there in the anterior chamber. You can see the lens. The lens in our eye may sometimes get dislocated and go into the anterior chamber. That is called as phacotopic glaucoma. Vitreous. Sometimes the vitreous can find a way into the anterior chamber. It may be due to trauma or it may be due to a surgical injury to the posterior capsule. The vitreous is going into the anterior chamber. Silicone oil. Silicone oil is an oil used to keep the retina in its position in retinal detachment surgeries. It acts as a tamponade. After some time, the silicone oil can come into the anterior chamber. Unlike a hypopion where you see in the lower aspect, the silicone oil is seen on the upper aspect due to reduced density of it, and that is called as inverse hypopion. So these are all some of the abnormalities commonly we see in the anterior chamber. Many more things are to be discussed, but time does not allow us to do it here. You can refer in the book. Thank you. We will see about the iris in the next video.